And good morning to the audience in here and online. I hope you can all hear me. So I'll just go quickly through what's N4. So N4 is short for the National Newcomer Navigation Network. This is a federally funded project that started way back in 2019. We started this project in the hope of forming a network from professionals who help immigrants and refugees settle into Canada. And this was really our first mandate. And it's the next one. Awesome. So today we'll just give you a quick background about N4, how we got involved with the foreign credential licensing of internationally educated healthcare professionals, what resources have we been able to develop for our internationally educated healthcare professionals, and also what learning opportunities we have. We formed a community of practice that we'll tell you more about, and then we're happy to get any questions. So this is just our team. We are hosted at CHEO, which is the Children's Hospital of Eastern Ontario, as a federally funded project. We are a team of 12, but we are working nationally, small but mighty team. And I'm really happy to be joined today with Andrew Tomayer, our education coordinator. As I said, our mission was really to create this national network from all those professionals and organizations who help immigrants and refugees settle into Canada. And our vision is that all Canadians, whether you have been living in Canada or you just arrived, you actually end up finding, equitable experiences when you are trying to find your way in the healthcare and and social services. This map just shows you the connections that we have made over the last 5 years. So we have connected with more than 400 organizations, from health, from settlement, from academics, from government, from lots of umbrella institutions also, as we are moving forward with our project. And our connections have been through in-person. So we traveled before COVID-19 to the provinces, and we spent time moving from one city to the other, or post-COVID, we started doing virtual connections. So all the organizations you can see here, we've really connected with them, and happy that we've connected with Pegasus for sure, and really appreciate the opportunity to present to you all today. We know that immigration is very important to Canada, both economically and our growth, and all the labor market is really dependent on immigrants, right? So as a country, Stats Canada just released that 99% of our growth over the last to date has been from immigration, really. And again, as a country that is really looking to fill gaps in the labor market, it's very important to welcome immigrants, but at the same time to be able to use their skills, right, to the best, and not to waste any of their brains, right? So this brain waste has really triggered the project that I'm going to talk to you about today. So again, healthcare has really been hit hard with the COVID-19. We always say it highlighted the gaps that already existed in the system for the healthcare, right? But I think it also highlighted the gaps in the way we are integrating our internationally educated healthcare professionals into the system. So currently there are 160,000 healthcare vacancies in the healthcare system, which really forms a huge gap. So healthcare is really one of the most affected, right? And now we have what we call the health human resource crisis. We looked, when we got this second mandate, to really look at integrating internationally educated healthcare professionals. Given that, we can't really address every profession, we started with nurses and physicians because those are the most gaps. And we looked at the data, and I don't think it's surprising to anyone in the room or online, only less than 40% of our internationally educated nurses and internationally educated trained physicians are integrated in our system. So that leaves 60% who are not actually working in the healthcare. So a huge brain waste. We got this new mandate. So now we have two mandates. We're working with the professionals who help immigrants and refugees settle into Canada. And we also work with the different stakeholders who are engaged in the licensing of the internationally trained healthcare professionals, specifically physicians and nurses. We know that for this process to happen, there has to be a huge integration between, your right hand has to really talk to your left hand. So immigration, when you're first coming, you have to really know and be well informed what's your pathway, how are you going to come to Canada, and then pursue your licensing process, right? Or again, if not, what will be the alternative pathways until you're able to do so. And then it's also important to understand all the policies that are around that and where you're settling in Canada. So that's another piece, because again, where you settle means lots of regulators will be involved and lots of regulations that might differ from one province to the other, or even from the territories. And then the employer piece, how employers are looking at international medical graduates and internationally educated nurses, and how willing they are to support them right in this pathway, their journey to become licensed. So what do we offer at N4? We have a website, and it's a free website. You can become a member by just joining N4, so newcomernavigation.ca. And on this website, we were keen to provide opportunities for professionals and now internationally educated healthcare professionals to connect with each other. So we have a member directory. We also have what we call a conversation cafe for our internationally educated healthcare professionals. We host conversations about network opportunities. We answer questions. We try to invite experts who can answer questions about the license piece, and opportunity to just share the journey, right, as you're going. And as we've seen today in the room, there were questions, and who would know more other than the ones who are going through the journey themselves. And also Andrew kindly, he captures and adds all event calendars that would be of interest for our internationally educated healthcare professionals and others. We have, we host webinars, and Andrew will tell you more about those in details, e-learning and resources. We have a huge resource library, and we partnered with St. Paul University since day one when we started 5 years ago. And through this partnership, we were able to provide 2 programs. Our second program is for internationally educated healthcare professionals. It's currently running. We have our 4th and 5th cohorts who are taking a 3-month program that would give them those non-clinical soft skills. I'll tell you more about it in a minute. I'll tell you about our efforts also for advocating for a change or changes for the current licensing process through our community of practice. And we have a long list of subject matter experts. So when you join us, you can easily reach to any of those subject matter experts with any questions you have or any requests. And I will hand it over to Andrew to tell you more about our resources.
Thanks, Sahar. So with our original development of N4, we began collecting resources and e-learning opportunities for those that are wanting to know more about the newcomer experience, those that work directly with newcomers. And alongside that, with our new mandate, we've begun collecting and collating many different resources related to IHP-related information, related to what's been discussed today by Pegasus and many other organizations. And nous avons les réseaux et opportunités en français aussi. Et désolé, la présentation, c'est seulement anglais. But we do have a good selection of resources and learning opportunities available in French too. So with that, we have our webinars. Currently, to date, we've had 62. I think this is September, right? Yeah, we've had about 64 webinars thus far, and 13, maybe even 14, I think now, are IHP related. They're free to attend, and we do bring together some subject matter experts that are very knowledgeable in the subjects that's being discussed at our webinars. With that, we bring together also some additional resources and learning opportunities that are directly related to the webinars that are being presented, both from the subject matter experts presenting, as well as many related to the similar subject matter from our resource toolkit. And to date, we've had well over 1,000 registrants who received the recordings afterwards, as well as well over 400 some attendees. And a good good proportion have been IHP. Those that are IHP related tend to be much more, those that are internationally educated healthcare professionals tend to be more attending the IHP related sessions as well. And as well, our next webinar is the next Wednesday. Excuse me. Next Wednesday, we'll be bringing together supporting IENs to relaunch and flourish in their nursing career in Canada. So feel free to check it out, as well as our various other webinars that are coming up. Along with that, we have our IHP newsfeed available to those that would like. Just move that. Okay, yeah, we've had thousands of page views of this news feed and thousands of news sources available to you. We pull directly from various different organizations that work directly with IHPs, including nursing associations, physicians associations, and even various other news sources across Canada. As well, we have our N4 mobile app, so feel free to check it out, take it on the go. You can feel free to pull the articles from our resource toolkit, check out our e-learning library resources, and many others. Along with that, we have our N4 St. Paul University IHP online program. One of our amazing profs is in the audience, Bianca, who will be speaking later today as well. And it's free, and it's funded through IRCC. And we're currently recruiting for our 6th cohort. So we've had the program in French and in English. Our winter program, just based around funding, will be in English starting in January 2024. But for example, this fall session has been both in French and English. And of that, we bring together many different subject matters that are related to helping provide that Canadian context and preparing to work within a Canadian environment within our healthcare system. Excuse me. With many different topics, including understanding the multiculturalism of our healthcare system, our Indigenous population, our social justice and ethics, and many other sessions, many other subject matters within the courses of this program. We've had almost 250 participants in this program across the globe of countries of origin. And from that, this is up to the 5th cohort of students. So we'll be interested in seeing what the 6th cohort of students looks like, which is currently open and available. So check out the website. Many have been saying very positive things as well about the program, including that the modules are very helpful. It helps give them help them be more fluent with the Canadian healthcare system and how it works, and are very open to working with the Suture platform that is available, easy to work with, and provides the online program to them efficiently and well. Overall, it sounds like they're very happy with what they've been receiving in the program. Along with that, the IHP newsletter, which provides the RSS news feed that was mentioned before. Thousands of people have been receiving it, so feel free to sign up and check it out. And finally, the Conversation Cafe, which Sahar touched on briefly. We bring together those that have been within the IHP program at St. Paul University. So if those that would like to participate in the program and would like to take the discussion offline, or not offline, but further online after they've completed the program, we also have that available as well. And with that as well, just to bring together our community practice, I'll pass back over to Sahar.
Just noting that the pre-registration for our cohort 6 for the SP program just opened on the 10th, and it will stay open till December the 10th also. So if you yourself or within your network, you know, others who would benefit from getting, you know, those 3 months online completely free, as I mentioned, program that would give them this, you know, non-clinical soft skills that we hear a lot about as you're doing your preparation for the exams, you're doing your preparation for the interviews, right? There's always comments that we heard from, you know, from universities and primary regulators, oh, but they're lacking the understanding the healthcare system in Canada, how it's working, understanding the Indigenous people, right, and their health in Canada. So we are trying through this program, through the professors at St. Paul University, to provide that. Candidates at the end of that, they get a certificate. And a big dream is that this program would be part of pre-arrival. So we're hoping that this would be something that can be taken even, you know, before you come to Canada, as an internationally educated healthcare professional, you'll be able to take that program.
And we accept up to 80 students to the program for those that have a Canadian, those living in Canada, with the exception of Quebec, just because how we're funded.
Yeah. So another thing that we were keen to work on since we got this new mandate was really to work on a community of practice. So we have at N4 actually hosted community of practice previously on different topics like, you know, the importance of interpretation, for example, for immigrants and refugees. But we really felt that, you know, it's very important to advocate for changes, right, to how the foreign credential and license piece is working in Canada. And the aim of that is really, and we were very, you know what I mean, cognizant of, it's very important to really, you know, this is a good timing. Now there is an HHR crisis. So how can we bring the voice, right, and bring the right people to the table? So we convened a community of practice, and in that we had a group of stakeholders who really are involved in the internationally trained physician pathway. So that was one working group. Another one was really for internationally educated nurses, another stakeholder group. And we know that it's very important to have this lived experience, right, voice. So we had two lived experience groups, one for internationally educated nurses, another for internationally trained physicians. They actually vetted all our work, and you know, and we were able to run through them the recommendations that we came up from those two working groups. So the stakeholder outreach, as you can imagine, it's very complicated, right? It varies from government level, provincial level, health regulators, right? The colleges who are regulating the process, right? Also, lots of you know, examination, like the Medical Council of Canada, for example, right? Lots of examination bodies who are involved, lots of language, right, bodies were involved. So we have convened all these stakeholders who would be involved in the pathway for license. And we reached out to more than 180 organizations, right? And we were able to, in these meetings, meet with the, you know, the ones who are involved in the process of licensing. And through that, we convened the four groups that I mentioned, right? So we were, first of all, we wanted to make sure that we have the right data. So we did a lot of research before we met with them. And then we brought them to the table and we started, right, discussing the process. How can we actually, you know, from Health Canada, even from the many presenters from the offices of the Ministers of Health, provincial ones joined us too. And we were able, through those intersectorial table, to come up with recommendations. So we first had a report that really talks to the journey itself. So it voices all the barriers and challenges in the pathway for license. So this is the missing part of me. And again, you can find this report on the website. And then we started coming up with recommendations that would be practical recommendations, right? We're really targeting, here's the pathway and this is what we see. And we also shared best practices that we were able to find maybe in one province that's not, you know, in another province, for example, or even outside Canada, right? So we're aware that there are other countries, you know, that receive a lot of immigrants and refugees, and they are doing it differently, right? Some similarities, but some differences. So we're able to bring all those through more than 40 recommendations that we have. We have 2 reports that are also on the website. They are one for internationally educated nurses and one for internationally trained physicians. We didn't want these reports to just sit on the shelf or be part of our website. We're continuing our work. We're convening our meetings with the different stakeholders from the government, as I said, from the colleges, from the regulators, to really kind of inform them, right, and tell them about this work, but also try to move the, you know, the work forward. So we've been convening those meetings, and then we circle back to our working group every 3 months, you know, for to tell them what we've been up to, and also to get feed from them. You know, things are moving very quickly, We know that the ministers of health just met 2 days ago, and for 2 days, right? And one of the things that they're looking at is really accelerating the pathway for internationally educated healthcare professionals. So it is on the radar for sure, but I mean, like, we are continuing that effort, and we're hoping that things would eventually change. I think that's it for us. So thank you. Thanks, everybody.
Thank you again.